My name is PBailey. I'm a nursing student in the baccalaureate degree program at Morehead State University. I'll be discussing the importance of patient handoff in relation to patient safety and quality of care. Nursing is a very difficult profession with multiple patients relying on us to know every detail about them. This level of knowledge is difficult to obtain during the end-of-shift handoff, which is noted by the Joint Commission to be the source of 80% of sentinel events. The quality and safety education for nurses competency which relate to this issue are patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, and safety. I'll be focusing on the two that I believe are the most applicable, which are teamwork and collaboration and safety. While there's no lack of information related to the importance of handoff to patient care, the evidence shows that there is a great need of standardization. One study shows that standardizing how a report is given results in fewer data omissions, greater knowledge of essential information of the patient by the nurses. This leads to reduced patient complications as well as reduction in time involved giving report. Another study corroborates these findings. The authors developed a tool called the MICU Shift Report Communication Scale, which assesses the nurse's opinions of the quality and quantity of communication during shift change. 33% of these nurses believed that information received during handoff was inadequate, and 50% believed that some of their coworkers did not comprehend the information that was being relayed. After the survey, an SBAR tool was implemented, and after implementation, there was an overall improvement in survey responses. The SBAR tool has also been the subject of research. This tool has been shown to facilitate the transfer of more consistent information and improve collaboration in line with the QSEN project competencies. The volume of information exchanged by the staff and its consistency was improved, and there was a net decrease in time required for report. Another method of handoff is the use of an electronic medical record to compile requested data. Utilizing an EMR to compile content for use during end-of-shift handoff would save time by quickly obtaining the information needed. And there are organizations who are successfully using these computer-generated handoff tools. Another important aspect of handoff is having the nurse giving report and the nurse receiving report present in the patient's room during report. This helps the patient to feel like more a part of the care team, also decreases the risk of medication errors, and enhances communication across the interdisciplinary team. The net result is increased quality of care and a decreased risk of harm to the patient. A great example of a breakdown in communication happened during my practicum. Had an elderly, intermittently confused male who was on diuretics for congestive heart failure. He was assisted to the restroom frequently throughout the day because of the diuretic, but that was not passed off during report. This resulted in a fall, luckily without injury, at about 2 a.m. A simple communication could have prevented this fall and possibly a poor outcome. Know that communication is the most important aspect of healthcare. I recommend a computer-generated SBAR formatted tool to be used by nurses giving report at the bedside as the best method of handoff. This will allow for quick gathering of high-quality, consistent information, and it will allow that to be relayed with input from the patient about their plan of care when used at the bedside. Education for nurses of this method should be completed in role-playing by the nursing staff. This has been found to be the method most effective for training nurses in SBAR communication techniques. Future studies could be performed about the extent of the effect of handoff on patient safety and outcomes. While we all know that it's an important aspect, there hasn't been any literature that has been able to provide empirical data showing the improvements in care achieved from standardizing patient handoff versus the current practice.